Hantavirus has killed 890 Americans since 1993. Nearly 40 in every 100 people who catch it do not make it out of the hospital. For comparison, COVID, at its worst, killed less than 1 in 100. There is no cure, no vaccine, no medicine that stops what this virus does once it gets inside you. But here is the thing that makes it different from every other killer on that list. You will never feel the moment it gets in. No bite, no cut, no sick person coughing near you on a plane. You breathe it in a shed you have used every summer for 10 years, in a barn you cleaned out last weekend, in a cabin your family has owned since before you were born. You drive home. You feel fine. You eat dinner. You go to sleep. 3 weeks later, sometimes 4, you wake up with a headache, some muscle pain, a low fever. You think it is the flu. You take some Tylenol and go back to bed. By that point, the virus has already been sitting inside your lungs for a month, and the mouse that put it there? Long gone. The dust it left behind settled back to the floor the same day you walked in. There was nothing to see, nothing to smell, no warning of any kind. That is why it is called a silent killer. 890 confirmed dead, 38% fatality rate, no vaccine on the way, and it is active right now in 35 American states. But here is the detail that tells the real story. The medical establishment did not know this virus existed in America until 1993. In May of that year, in a trailer home on the Navajo Nation in New Mexico, a 19-year-old man collapsed. He had been healthy the week before. Within 48 hours of his first symptom, his lungs failed. He died before doctors understood what killed him. 5 days later, his fiancée died. Same progression, same speed, same complete respiratory failure in a person with no prior illness, no risk factors, no explanation. The Indian Health Service contacted the New Mexico Office of Medical Investigations. What followed was the largest emergency epidemiological response the CDC had mounted in a decade. They found more cases. Navajo Nation, Colorado, Utah, Arizona. The four-corner region where those 4 states meet at a single point on a map. They found a virus, a previously unknown strain of hantavirus carried by a single species of rodent, the deer mouse. Peromyscus maniculatus, one of the most common small mammals in North America, present in every rural county in the continental United States. The virus had always been there. The deer mouse had always been there. The pathogen had been shedding into the air of American barns, sheds, cabins, and crawl spaces for decades, possibly centuries, before a cluster of deaths in New Mexico in 1993 forced anyone to look for it. Every case before 1993 was filed under respiratory failure of unknown origin, under adult respiratory distress syndrome, under deaths that went unexplained in rural hospitals that had no reason to look for a hemorrhagic fever virus in a New Mexico wheat field. The timeline is what no one told you. May 14, 1993. A 19-year-old man dies in New Mexico. The cause unknown. May 19, his fiancée dies. The CDC mobilizes. June 1993. Scientists identify the deer mouse as the reservoir. The virus is named sin nombre, Spanish for no name. By August 1993, 24 cases identified. 13 deaths, a 54% fatality rate in the first documented cluster. By 1995, the case count crosses 100. The confirmed reservoir is in 35 states. The virus has no treatment pathway. Supportive care only, meaning doctors can manage symptoms, but nothing they administer stops the progression. By 2,200 confirmed cases in the United States. Mortality stabilizing at 38% as early intervention improves. By 2012, Hantavirus reaches a place where 4 million Americans camp every year. Yosemite National Park. Curry Village. 10 confirmed cases, 3 deaths. 10,000 park visitors sent notification letters that they may have been exposed while sleeping in signature tent cabins the Park Service had certified as safe. The deer mice had been nesting in the wall insulation. By 2025, The confirmed cumulative case count since surveillance began, 890 Americans dead. The fatality rate unchanged. The reservoir unchanged. The risk population expanding as rural property ownership, off-grid living, and national park visitation all reach record highs. And the virus has not changed. It is still the same pathogen, still carried by the same mouse, still transmitted the same way, still invisible at the moment of exposure. The deer mouse does not look like a threat. It is 4 inches long, gray-brown, with a white belly, large black eyes. It is the most widely distributed wild rodent in North America. It lives in grasslands, forests, deserts, agricultural land, and the insulation cavities of vacation cabins in the Sierra Nevada. It sheds hantavirus in its urine, in its saliva, in its droppings, continuously, passively, whether it is sick or not, because the virus does not make the deer mouse sick. The mouse is the reservoir, the host, the permanent carrier. The virus survives outside the mouse's body for up to 3 days in dried form. In a sealed, unventilated space, a barn with no windows opened since November, a storage shed, a crawl space, the survival window extends further. When a human disturbs that dried material, sweeping, vacuuming, shifting old boxes, moving hay bales, the particles become airborne. They are too small to see, too small to smell. They are inhaled before the person registers that anything is different. 18 to 36 days later, the first symptom appears. A headache, fever, muscle pain. This is the phase where almost every HPS patient dismisses what is happening. They take ibuprofen, they rest, they wait for the flu to pass, but that is only half the problem. There is a 4 to 10 day window after first symptoms that doctors call the cardiopulmonary phase. This is when HPS separates from flu with no warning. The virus attacks the capillaries lining the lungs. It makes those capillaries leak. The lungs fill with fluid from the inside, not from infection, not from bacteria, from the body's own vascular system being dismantled cell by cell. The patient begins to feel short of breath. Within hours, in severe cases, they cannot sit upright. Their blood pressure drops. Their heart rate spikes. Their oxygen saturation falls off a cliff. Mechanical ventilation. An ECMO machine, a device that removes blood from the body, oxygenates it externally, and pumps it back, is the only intervention that has meaningfully improved survival rates in the most severe cases. Second, the outcome gap. Patients who reach a hospital with ECMO capability survive at significantly higher rates. Patients who reach a rural emergency room without it, the same rural counties where exposure is most likely, do not have that option. Third, the zero treatment problem. There is no antiviral drug approved for HPs. Ribavirin, tested in clinical trials, showed no benefit. The NI has no active HPs vaccine in Phase 3 trials as of 2025. The research funding for hantavirus ranks among the lowest of any pathogen, with a greater than 30% case fatality rate in the United States. Fourth, the undercount. The CDC's 890 figure represents confirmed, laboratory-diagnosed cases. HPs requires specific testing that must be ordered by a physician who suspects hantavirus, which means cases in rural areas, or cases where the physician defaults to community-acquired pneumonia as the diagnosis, are not in that number. The true total is unknown. Picture this. Merrill Bahe was 20 years old. He lived on the Navajo Nation in New Mexico. In May 1993, he collapsed after 5 days of flu-like symptoms. He was rushed to a hospital in Gallup. He died before doctors understood what had killed him. His fiancée, Florena Woody, 21, died 5 days later. The same progression, the same speed, the same complete collapse of healthy lungs in people with no prior illness and no risk factors. What happens next is the part nobody can answer. Why does hantavirus receive a fraction of the federal research funding of pathogens with lower fatality rates in diseases that affect fewer Americans? What does it mean that the populations at highest risk, rural homeowners, agricultural workers, hunters, off-grid residents, national park visitors, are exactly the populations least likely to have access to an ECMO-equipped ICU within a survivable transport window? How many of the respiratory deaths filed as unknown origin community pneumonia in rural America since 1993 were actually HPs, in counties where the ordering physician never considered the diagnosis? And what happens to that 890 number as rural property ownership continues to expand, as more Americans buy land, build cabins, store equipment in sheds, and move into counties where the deer mouse has lived for 10,000 years? Consider this. Between 2020 and 2024, rural property purchases in the United States increased by 47%. Americans who had never owned land bought acreage in Montana, the exact states with the highest confirmed HPS case density. They bought old farmhouses with original barns. They bought hunting cabins that had been sitting closed since the previous owner died. They bought land with structures they had never inspected in counties with one hospital, no infectious disease specialist, and no ECMO machine within 200 miles. They cleaned out the sheds themselves. Because that is what you do when you buy land. You go in. You sweep it out. You make it yours. No one handed them a warning. No federal agency required a disclosure. No real estate transaction in any of those states mandates hantavirus risk notification the way flood zones require flood disclosures. The virus does not know about the new construction. The mouse does not know about the new owners. The dust does not know to wait. Sin nombre. No name. In a sealed barn in rural America right now, a deer mouse is moving through the dark along a baseboard. It does not know where it is. It does not know what it carries. The virus it sheds is landing on the floor, on the hay, on the cardboard box someone will move in the spring. Outside, the land has a new deed. The new owners are planning their first visit in March. They are excited. They have a truck. They have cleaning supplies. They have no idea. The deer mouse is gone before the sun comes up. The dust settles back, and the air is still.